My name is Cynthia Webb, registered nurse and certified aesthetic nurse specialist, and welcome to my YouTube channel, Practicing the Fine Art and Science of Aging Gracefully. In this episode, we'll be discussing the differences between medical grade skincare and over-the-counter, drugstore, department store, online, and multi-level marketing skincare. Moving forward, we'll name that cosmetic skincare. First, let's talk a little bit about your skin. Your skin is an organ, just like your heart, your liver, and your lungs, and it's the most important organ. It regulates our body temperature, it maintains our fluid and electrolyte balance, and it protects us from infection, among other things. If you don't have skin, it doesn't matter how healthy your other organs are, it's incompatible with life. The skin is comprised of different layers and structures, and we'll talk more in depth about that in another episode, the functions of the skin. I am passionate about skincare. I discuss skincare with every patient that comes through my door for a consult, probably more than what they'd like. It's very important. Your skin is the canvas of your masterpiece, and if the canvas isn't primed, it doesn't matter what procedure or treatment we do, you will not get an optimized result. Whether that be light treatments, injectables such as neuromodulators or dermal fillers, skincare is the canvas. Prime the canvas first, and you'll get a much better treatment. Your skin will respond better, you'll recover better, and you'll be much happier with the result when you have a healthy skin. Have you ever heard of medical grade skincare? I hadn't. And here's my story. Years ago, I struggled with rosacea, and it was something that ate away at my confidence, and I wasn't even able to go out to work out without makeup on. I had a roadmap of vessels on my skin. It looked like I had been slapped or scalded in my face, and I didn't know what to do. I tried everything over the counter. I tried everything online, in the drugstores. I just couldn't find a solution for it, and I had no idea what to do. So I went to an aesthetic nurse specialist, like many of my patients do coming to see me. And she talked to me about medical grade skincare and also having a light treatment in order to close those vessels and improve the look of my skin and the health of my skin. I thought to myself, medical grade skincare, I've never heard of such a thing. And then the light bulb went on. As a nurse working in evidence-based practice, of course there would be such a thing. You buy something over the counter when you get a cut with a little bit of antibiotic in it, but once that cut's infected, you go to the doctor to get a prescription for antibiotics, something stronger that's going to heal that infection. And that's kind of the trajectory of how medical grade skincare works. Medical grade skincare products are designed to be corrective and treat a multitude of concerns and diseases. Acne, textural issues such as large pores and pilosebaceous units, which is just a fancy term for lumps and bumps that are benign on the skin. Rosacea, which I had, hyperpigmentation, sun damage, fine lines and wrinkles, post-inflammatory hyperpigmentation, which is a result of trauma on the skin, and melasma, which is very stubborn. Medical grade skincare contains highly stabilized pharmaceutical grade ingredients. It has an enhanced delivery system and a higher percentage of those active ingredients. They penetrate deeper into the dermis where all the magic happens. They are strictly regulated by your health standards and have to provide extensive research in order to substantiate what they do. Cosmetic skincare claims to have products that contain active ingredients such as retinol and vitamin C, but typically only trace amounts along with other additives that really don't make any improvements to the skin. Cosmetic brands sit on the surface of the epidermis. Remember I said that the magic happens down in the dermis, and that's where medical grade skincare goes. Cosmetic brands will maybe make a temporary improvement in your skin. It might feel softer, but it's not therapeutic. It's not going to make any change improving the health of the skin. Cosmetic skincare companies never invest in marketing that seduces you to buy their product based on anecdotal information. That's feedback and subjective information from people that are asked to use it. So if you look on a lot of the marketing material, it'll say 8 out of 10 women report an improvement in fine lines and wrinkles. But that's not scientific measurable research to support the statement. If you read the fine print, you'll see that it's usually based on consumer surveys. Medical grade skincare, on the other hand, those companies have scientific, clinical, peer-reviewed research that supports measurable data that supports and guarantees that their products work and provide results. They reinvest their products into further research, not big shiny marketing campaigns. This is why you will rarely see advertisements for medical grade skincare. Medical grade skincare is only available through a physician or dispensed through their designate, which would be a registered nurse or a medical esthetician. We ensure it's safe for you to use after a thorough skincare consult and a health history. We follow up on your progress with follow-up appointments to ensure that you're getting the results that you need to get for your concerns. It's a customized skincare regime specific to your concerns, not a cookie cutter approach. Cosmetic skincare is not sold by a skincare specialist, and you won't receive the follow-up because there's no significant improvement or changes expected. And most medical grade products are comparable in pricing to the higher end cosmetic skincare sold through department stores. And although the price point might be a little bit higher, you are clinically improving the health of your skin by correcting skin conditions, restoring barrier function, and preventing future health concerns. So I hope you like that little primer on the differences between medical grade skincare and cosmetic skincare over the counter. I hope you'll like and I hope you'll subscribe to my YouTube channel. And the next episode will talk more specifically about protocols to address specific skincare concerns.